Stacey, welcome to Midlife Advice. Thank you so much for coming on the show.
Oh my gosh, thank you so much for having me. This is awesome.
It is awesome because we get to talk about the pain that a lot of us are feeling, which sucks. And you have some ideas for us that maybe we haven't heard of before. So I'm excited to share those with my listeners. So, to just set the stage, we're going to be talking about some of the common types of joint pain that affect midlife women, like frozen shoulder. I'm sure you've heard of it, tight, stiff hips, inflamed knuckles, which I get from time to time. And so, the first question I want to ask is pretty general. Is joint pain in perimenopause and menopause primarily a hormone problem, or is that an overly simplified explanation?
It's that answer of it depends. So I would say it's very common. Like if you look at the research that compares hot flashes in perimenopause and menopause to joint pain, and some studies joint pain will win out. So it absolutely can contribute, but there's a lot of factors that contribute to that as well. Those hormones are like our anti-inflammatory protectors when they're in a good balance between estrogen and progesterone. And then all of a sudden, when those levels start to fluctuate, we lose some of that anti-inflammatory protection, right? And then you hit menopause and we have basically hardly any of it left. All the things that we were doing for years that were probably creating inflammation and our body was just able to manage. We don't have that ability to manage that as well anymore. So it really helps us identify like things that we're eating, some lifestyle choices that we're making that could really be creating inflammation in our system, and then contributing to also the low estrogen progesterone levels, estrogen specifically, the thinning of the collagen and the issues with ligaments, tendons, connective tissue, fascia, all those things that make us feel stiff and hurt will also bubble up to the surface as well. So I wouldn't say hormones aren't the only contributing factor, but they're a big part of it.
Yeah, and I think you can extrapolate from what you said that you could be doing all these same exact things and yet now feel pain due to inflammation. So you're not crazy and you're not doing anything wrong. It's just you've sort of lost your body's natural Advil, so to speak. Is
Yeah.
that fair to say?
Yeah. I wouldn't compare it to NSAIDs, but
Yeah,
yeah.
I know. Yeah. Well, so we know that when drops in hormones are at least correlated with, if not maybe the only cause of joint pain, inflammation, muscle soreness, that we can supplement with HRT if we choose to, and that could help a lot of women. But what are some of the other options that we have, maybe non-drug, non-injection options that we
Mhm.
have that people don't know about, that aren't talked about in the mainstream?
We really don't ever prepare ourselves for menopause and perimenopause by looking at our diet. Right. So many of my friends who are going through and having hot flashes, I'll ask them, well, when are you having them? And a lot of times it's in the stressful, they're getting angry with their child or they're getting frustrated with something on the computer. And then all of a sudden they get this hot flash, right? That now they're also at nighttime as well, too, and where the sweats happen as well. So, it really, there's so many different things that we can do from managing stress, right? Breathing, a lot of times it sounds simple and almost ridiculous, but really, it really is effective because when we're stressed, we have that kind of shallow breathing. So we don't allow our body to get into that parasympathetic nervous system.
I'm actually a breathwork facilitator for midlife
There
women.
you
So you are preaching to the choir, my friend.
go. Absolutely. So that's probably the easiest and the cheapest thing that we can do, right? For
Yes.
anything related to stress. And then dietary, right? Dietary stuff. I hear so many, to your point, just a little bit later, I hear so many women coming to me and say, I'm doing exactly the same thing that I've done for the last 10 or 15 years. And maybe that's even eating healthily. Maybe they made some lifestyle choices back in their 30s and stuff to improve, and maybe they've given up gluten or dairy or whatever it is. And some of these symptoms are still coming in and they don't know what to eat. So that's where we look at doing some food sensitivity testing. I personally use the LCAT, the IgG test, I as in Idaho, G as in George, G as in George. Really don't have a lot of good data behind them, but the LCAT and another test called the MTR have some good data. And that shows which healthy foods or foods that we all typically think are healthy may not be reacting really well with you, right? With your system. It doesn't mean always getting rid of those completely and forever, but rebalancing the gut so that you can start to tolerate some of those foods or eat them less often. Things like that are really the first place to start
I
because
actually did a food sensitivity test with my naturopath not too long ago, a few years ago. And I know I've known since I was a child that I've been allergic to cow milk and never actually got the official test because my mom said, "Oh, your brother was too." I knew the signs. I didn't need to bother. But boy, that came up very clearly on my test. But so did some other foods that I eat regularly that I didn't notice. So I think it's important to get this data because it like eggs showed up for me, almonds showed up for me. I was making smoothies with almond milk often. I was eating eggs often and experiencing some kind of like I would say maybe low grade inflammation symptoms.
Mhm.
And it's what's interesting is you could have a sensitivity of food and know really well I'm sensitive to that food or I'm allergic to that food. And you can have a sensitivity and not be able to connect the dots back to that. So super helpful to have that information.
Absolutely. And with food sensitivities, it can be, you think you're doing the right thing, right? So I've had people who have been sensitive to blueberries and they're like, blueberries? Like, how can I be sensitive to that? And again, that once you then work on your gut and optimizing your gut health, then sometimes you can add those things back in. But there's usually just a few that you're like, actually, that's not going to work for me. And for me personally, that's gluten. For other people, it might be, white potato. Another person, it might be chocolate. So it's very individualized. That's why that data is.
Okay, so food sensitivity test. What else could we be doing from the general standpoint of trying to improve inflammation, pain in joints and muscles?
So general movement is great. So making sure that if we're playing sports like pickleball or doing activities that we love, that we're also preparing our body for that. So we're doing, CrossFit, I wouldn't say is the best for everybody, but cross training, right? So you're doing your flexibility, you're doing your mobility and, walking, or if you're still running, just balancing those things out to keep movement going and keeping your range of motion improved. Because when we hit menopause and we lose some of those hormones, that stiffness of our tissue, including these things called joint capsule, which is related to frozen shoulders. Those joint capsules lose some of that support from those hormones too, and then can kind of shrink. So if you think of a shoulder, it has a capsule around it, just like the hip, and that capsule is kind of like a balloon that keeps all of that lubrication, or what's called synovial fluid inside, that usually lubricates the joint. And as we age and lose some of those hormones, that kind of balloon can shrink a little bit. And if you've got an autoimmune issue, or if you have the hormone issues, or a combination of both of those things, or your blood sugar levels are off, all that can then compound those things. And so keeping that movement as best you can, and addressing it as soon as possible. If you are finding that you're lifting for what seems to be no reason, get that addressed. Don't wait until you can't lift your arm up, or that your hip hurts so badly that you can barely walk. Getting those things addressed by a physical therapist right away will really, truly pay off in the long run.
So we've talked about stress management, diet, movement. These are the pillars of health, the basics, the foundations that come up as themes in this podcast all the time. The fourth one being sleep. Would you say getting proper sleep would help us here too?
Absolutely. But the thing about that is, when you're going through menopause, it's not like we're not trying to get sleep, right?
Right. Thank you.
Like for me, I'm like, in my 40s and 50s, I'm like, how can I get home to get to sleep, right? So there's not many people out there, at least that I know, that are like, well, I don't want to sleep. I mean, everybody, as we come to that age, we're like we can't wait, right? But so with the hormone changes and stress, and potentially, again, the food, all those things that we just previously talked about, that can interrupt sleep. So really figuring that out and that balance out for sleep is really important to help. But because even with HRT, progesterone can often help people with their sleep patterns. But even with HRT, there can be sleep issues if those other things aren't addressed.
Absolutely. And I actually have a free breathwork for sleep session specifically designed for midlife women. I will link to that in the show notes. So
Please.
please give it a try if you're struggling. It absolutely helps me. It's not a panacea, but it can definitely help. I do want to go back to that movement pillar you were talking about, where we can get into a vicious cycle here, right? Like a lot of us know we need to be strength training, but how can we do that if we have frozen shoulder or knee pain or hip pain or inflamed joints and we can't even grip the weight? Like, what do we do when we feel like we can't get started?
Yep. So something like yoga, we oftentimes think of just, I've got to lift heavy weights now. We're told that over and over and over again, but really the movement of yoga, that flow that you can get into for that is really helpful. Those movements that keep those joints more lubricated and continue to bring blood flow to those areas that are stiffening up, right, is really, really important to add to your exercise program. But when you've got pain, this is where the perfect storm comes in, right? So you have to find ways to continue to move, because the vicious cycle is I hurt, therefore I don't move, therefore I get tighter, therefore I hurt more, therefore I don't move. And then all of a sudden, you're on the recliner and you've lost all this range of motion and strength, right? So working with a movement coach, a physical therapist, a personal trainer, just to allow you to move within the range that is not painful, so that you can gradually increase that and see, like for me, it would be a physical therapist that would look at your biomechanics, right? So how are you moving? How can we adjust things that might be triggering, your inflammation or irritation, now that we have less of the hormone levels for that protection that our body would have been able to get away with before, but can't get away with now. So adjusting those movement patterns, working with somebody who's an expert at picking those things out, like what we do in our clinic is, I don't care if you come in for a knee, a shoulder, your big toe, we're looking at all the movement patterns of the body and how you're walking and how you might be getting up from the chair, and giving little tips and tricks about how to kind of balance your body out. And then nobody has to be perfectly neutral, but taking some stress off of those joints that are being irritated can go a long way to help with pain.
And I think it's such a good reminder that there are always options. It doesn't have to be a 60-minute, really challenging, heavy weightlifting workout for you to get any benefit. And I mean, I learned this the hard way. I've been teaching fitness for almost 20 years, and I had to go through a phase where I could not do the workouts that I had been doing for over a decade with no problem, feeling great. There was a period of several years there where I could not do them without being so sore after that I felt like I couldn't do anything for 3 days.
Mhm.
And then I put my ego aside and realized, like, oh, wait, it doesn't have to be 60 minutes. It could be 35.
Mhm.
And I started just kind of playing around with the amount of time I was spending doing these workouts. And that's one lever you can pull. So is the frequency, so is the resistance that you're using, if any. So just remembering, like, it doesn't have to be what worked for you before. You might need to get a little creative, and you might have to swallow your pride a little bit to find something that works for you now. And then I can attest that once you do, you feel great again. And I love my shorter workouts now. Now 60 minutes feels way too long to me. Like, who has time for that?
Exactly. I think you hit the nail on the head. Is sometimes it's an ego thing, right? And then sometimes it's I've always done these. Why can't I do them now? Well, our body changes, right? So we want to adjust with those changes. And then once we do, to your point again, you usually enjoy it, right? You usually like the adjustment because it makes your body feel so much better.
So let's talk about the people who are getting their frequent workouts in, but they're not feeling the same. Like my example was, I'm doing my workouts, but I'm getting so sore after that it's not fun. Like this isn't it. It was good sore, as in it's not painful, but it's lasting too long and it's not enjoyable. And like I'm okay with 1, maybe 2 days of soreness, but 3, 4 is too long for me. What can we do in those types of cases?
So the first thing I would look at in those types of cases is what medications, if any, the person's on, because sometimes the medications can exacerbate that soreness, and, things like statins. So, I see a lot of women in their 50s who are on statins for different reasons. So sometimes we have to work around that because that can cause some of that stiffness and soreness, even in things like a simple stretching exercise that used to be fine and great, and now it hurts like crazy every time you do it. If there's no medications that seem to be causing or contributing to the issue, then we look at things, we kind of look at that holistic view again of how people are generally moving, right? And seeing if you're overdoing it. And then if you are balancing that out, then we check out your cortisol levels as well too. Because if your cortisol levels are too high, and everybody talks about that, cortisol and stress and it being too high, that can be inflammatory. But what a lot of people don't talk about, which happens if somebody has been really busy, really high energy, high achiever, doesn't stop. Am I describing you at all here?
You're describing my whole audience. We're listening.
then your cortisol levels can actually be too low. And what people don't understand about cortisol is that's also anti-inflammatory in its nice and balanced area. So then you lose some of the anti-inflammatory aspect of cortisol. And if you ache at night and only at night, and you haven't been able to relate it to food, sometimes it's because your cortisol levels get too low at night and you lose some of that anti-inflammatory, and then that inflammation kind of bubbles up. Now, I'm not talking about Addison's disease, which is a diagnosis of somebody who's not making enough cortisol and they need to be supplemented on cortisol. That's completely different. This is, you're still functioning, your cortisol is still being created, but it usually should be highest in the morning when you wake up and then gradually come down to be the lowest at night. So it's not stimulating you and you can fall asleep. But if it's too low in those times where it should be high and giving you that good anti-inflammatory support, then you run into trouble and your body is broken down a lot faster, just like as if it was too high. So finding that sweet spot for cortisol, breathing, again, going back to that, has a huge aspect to managing that stress. And high cortisol, honestly, can be managed a lot more easily than consistently low cortisol over time. So that's a bit of a bugger, and you want to work with somebody to support your adrenals and get that cortisol, that diurnal rhythm that we call it, back on track.
So interesting that cortisol can help with inflammation. We often, hear about all the evil effects of chronically high cortisol, but to your point, it's there to help us.
Right, right.
It's there to mobilize us when we need to be mobilized.
Exactly.
What about when the pain happens with respect to workouts? Like if the pain is happening as you're working out versus a day later, should we address those things differently? And, should we be modifying if we're feeling the pain during the workout? What kind of pain do we know is pain that we need to modify for versus just you're in your 40s, 50s now, and this is what it feels like to work out?
Absolutely. So with things like I instruct my patients, or I try to teach my patients who maybe haven't been athletes in the past and really haven't experienced kind of stretching sensation versus what's painful. Because stretching can be, painful, but is it a stretch sensation, which is good? You're lengthening the muscle that was tight because, we all sit so much these days, right? Or is it the sharp shooting pain that you have an intuitive sense that your body's like, yeah, that's not good, right? So it's within the joint, sharp shooting. Usually don't get an ache during the workout unless you're doing, too many reps in poor posture or the wrong position. Then you might get that little bit of aching going on. So if it's more of an aching, I would correct that posture, maybe decrease the weight or decrease your reps, and then continue to go through as much pain-free range of motion as you can. If it's a sharp pain, I again would stop in the middle, check how I'm moving. Maybe I need to do a little bit more flexibility or mobility before I attempt that exercise again, so I have more range of motion and I'm not trying to fight against these muscles that are just fighting against me because they're too tight. Oftentimes I see that as people like, oh, stretching doesn't work, and then they just do the strength training. But if you don't stretch as we get older, we will lose that mobility, because we're not running around on a basketball court or volleyball court, or even pickleball is kind of confined tennis, right? So we don't use that range of motion that we would have in our teens and 20s later on. So we do tend to get tighter, especially in the front, pecs and things like that. As we're on our phones and on our computers all day, that all tightens up. And if we don't stretch that out, we go for that pickleball shot behind, and guess what's going to get injured, right? Your shoulder, your neck, those types of things. So we want to maintain that mobility in the joints throughout. So during a workout, listen to your body. And if it seems like, yeah, that wasn't right, take a minute, reset yourself, maybe stretch a little bit, and then try it again within that pain-free range of motion.
And as a Pilates and bar teacher for 20 years, I love hearing you talk about the importance of mobility, flexibility, stretching. That's woven into all the workouts that I teach. I'm a big believer in range of motion because what we used to be taught was a muscle that is strong but not pliable doesn't do you any service. So the muscle needs to be able to contract and release. So given that, tell us what you think is the best post-workout recovery routine for us. Should we be stretching, foam rolling, sauna, ice bath, massage guns? What are you a fan of?
Well, So there's so many things that you can do. Number one, I would say do what you enjoy doing, right? I love the sauna. I think it's great, but sometimes it's hard if you don't have one in the house or find that extra time to do it after you, especially if you're like doing a 60-minute workout and then a 20-minute sauna, it adds more, right? But it is fantastic to do. I personally hate the cold, so I wouldn't do a cold plunge, but other people might be like, that makes me just feel so good and refreshing. And would it help to manage the inflammation that potentially was created with the workout? Yeah, but I'm not personally not going to force myself to do it and then just hate that afterwards. I personally like more of a flow, like a stretch afterwards, because that's when I'm warm and that's when I can get that mobility. And that's one thing that I didn't mention before is getting that mobility is important, but also working on the stability. So once you've gained that mobility, work on the muscle, not just strength, but stability of being able to manage maintaining that mobility that you just gained. So it's not always just about strength. You want to look at strength to be strong. Yep. And heavy weights are good for muscle and muscle metabolism, but we also want stability because stability will keep us from getting injured as
And
well
we,
as the
I love that you're bringing this up. We talk about exactly that in Pilates classes. There's always a part of the body that's moving and then a lot of the body that's not. And oftentimes we'll cue more the parts that aren't moving because those are the stabilizing muscles that need to fire to hold you stable in your pelvis, for example, when you're moving your legs. Or
Exactly.
where can you stay stable? Can you stay stable in the shoulder and move the arm in the shoulder socket? So I love that you're bringing that up. Like it's all holistic. We have to look at all aspects of this to keep ourselves functioning optimally. And if, pickleball is what you love, to your point from the top of the show, cross train that. What's the right cross training for you so that you can perform well in the game that you love to play?
Exactly. And most people just go out and play because it is relatively straightforward, right?
Right.
But then they just don't prepare. And honestly, I mean, pickleball could keep my clinic in business for a long time because
No. Okay.
happy,
Okay.
be happy if people, if I didn't have to see them, right? And we'd be less busy because that means that they're preparing their body for going out there and having fun and working out versus just jumping out there and then risk getting injured and then not being able to participate for weeks or months on end.
Right, right. Another thing you've said is that muscle weakness can be a contributor to joint pain. And I think this is sometimes counterintuitive to some people. So tell me what you mean. How does that work?
So let's say there was an injury. I'll give you an example of my personal experience. So back in 2021, I was at a wedding with my son, who was at that time 21 years old, and he was out on the dance floor trying to do a polka, and it was a little scary. So I had to go out and show him what a good Midwestern polka actually looked like. So he and I are doing the polka, 1 2 2 1 2 2, and my knee just popped. Like I felt like everybody in the barn, it was a barn wedding, everybody should have been able to hear it. Of course, nobody did, but I just felt like somebody took a fork and just jabbed it into my knee. So I hobbled off the dance floor. It doubled up in size. Thankfully, I have my clinic. My son did have to go get me crutches at 2 a.m. at Walgreens, but so I hobbled home to my clinic. I treated it with my device called SoftWave, which immediately brings down the inflammation and allows me to do the rehab. So I was good within like three treatments of that. Back on track again. Thankfully, I have the knowledge that I do and the ability to treat it like that. Fast forward a year after, it took me probably a good 3 or 4 months to really get back to where I needed to be and my journey. That was kind of my first clue that I was starting to deal with the musculoskeletal syndrome of menopause. Because prior to that, I really hadn't had any menopausal issues that I really knew of. But then once other little things started to happen, I'm like, okay, that makes sense. But fast forward about a year after that, I started to develop plantar fasciitis for like no reason, and I'm like, what in the heck, I pretty much ignored it because for some reason my physical therapy brain went, you can't have plantar fasciitis, like too much, right? But when I sat down and thought about it and paid attention to myself to take care of myself, I realized that when I interviewed 100 women who had plantar fasciitis before, 60% of them had a prior injury. So when I had my knee injury, my hip became weak because of how I was compensating as a result. And therefore, the weakness in my hip actually made we call it internal rotation, made my hip internally rotate slightly, which made my arch fall, or what we call pronation. And so that kept on stretching the plantar fascia. So again, along with having lower estrogen levels and that fascia not being as pliable as it was before, I developed the plantar fasciitis. So I didn't really have to work much on my foot from a strength point of view. Did some flexibility there, but the strength part, the weakness was really in my hip. So then once I was able to strengthen and stabilize my hip and do the flexibility exercises around my ankle and gastroc, that was able to get rid of my plantar fasciitis. So that would be an example of how weakness can, kind of set you up for an injury down the road, or over time with compensation because of weakness that can set you up for injury.
Yep. Weakness in the hip causing pain that you feel in your foot or
Yep.
shooting up your heel. I've had plantar fasciitis. It's incredibly painful. I have no idea how you ignored it.
Yeah.
I couldn't walk on my heel for weeks at a time, but luckily that's better. And I fall in the 40% that didn't have an injury before. So it happens. It happens. And you've also mentioned, I love this, that strength training is a form of pain medicine. But heavy lifting isn't necessarily the only effective approach. So, what are some other approaches that might feel more feasible to your average midlife woman who's not a heavy lifter?
So the bane of my existence right now is many of the experts who are fantastic and extremely knowledgeable getting on podcasts and going, we must lift heavy, heavy weights and da, da, da. Though I don't agree with that. Though I don't disagree with that 100%, somebody who's never lifted weights before, maybe is losing weight, or whether they're on a GLP-1 or not, they're on the journey of losing weight. They can't just start off lifting heavy weights because, again, they're setting themselves up for coming to my clinic to be injured, right? So we want to ease into it. So if it depends on where your baseline is. If your baseline is no exercise at all, then start doing things like, Pilates and yoga, advance to things like bar like you do. Use more body weight to help with your strength training, getting your muscles engaged and your joints stabilized, and doing those flexibility exercises. And then start to look at increasing the weight. And you can do that now in different ways with body weight, right? You can use a ruck thing to walk with, or use that while you're doing yoga. Things like that can help with increasing that body weight. And then if you're comfortable, and especially having good instruction, utilize somebody to help you with weightlifting. And that might be, a 6-month journey, right? To get to that point where you're lifting heavier weights than you did. It's important that we do continue to work and do resistance exercises, even with bands. We can, add some things for extra resistance with bands. And there's so many different ways to do it today. And, lifting heavier weights than what you're used to is really, it is very good to challenge your muscles, to get them stronger, maintain your metabolism, not losing that, eating enough protein to maintain your muscle mass as well too. It all helps to balance each other out.
Yeah, and I like that you point out too, there's so many different ways to add resistance. So heavy weight is one resistance option, but so resistance can be your own body weight, gravity, bands, tubes, springs. If you're working on a Pilates reformer, there's lots of options for ways you can add resistance. So thank you for pointing that out. It doesn't have to be heavy, dumbbells that you're lifting, or,
Right.
deadlifting. I don't even know how many pounds.
Yeah.
Okay, so for anyone who's listening who's like, okay, well, I kind of stopped working out because it just doesn't feel good anymore, what's one piece of advice that you would give her to help her get going again?
So it might be counterintuitive, but look at your eating plan. Really, that's the big thing. If we go back to the beginning of the podcast, fine. If you feel like you're really eating healthy, do some sort of food sensitivity test that's accurate and has good research behind it. That's really going to be, for me, always going back to that, number one, because that's going to support your gut. So your gut needs to be optimized in order to decrease inflammation. There's something called the gut joint axis. So even some people just need to even start with a probiotic, right? That first step with a good probiotic can help some people if they have bloating or other symptoms. So that's where I would start, and then kind of slowly move into that pain-free range of motion and seek guidance. If you haven't really been a person that's moved, if you haven't really been an athlete, or even if you have been and you don't necessarily have a lot of education about the human body, get help from somebody, from an instructor, like yourself, or a physical therapist, or a personal trainer that understands menopause and understands how to work around injuries and things like that. So, seek help because going on YouTube, I can't tell you how many times patients will come in and say, well, I did your exercise and then I added these exercises on YouTube and I think I hurt my back. And so like, make sure if you have somebody, if you see something on YouTube, you've got somebody you can go, hey, can you take a look at this? Would this be good for me to do? Instead of just jumping in and doing it and then ending up hurting yourself, right? So keeping all those things in mind, depending on where you're starting from.
I love that. And I know it can feel like a barrier to walk into a gym and ask for a personal trainer. That can be really scary, but just know that they want to help you and that's what they're trained to do. Same with Pilates teachers, bar teachers. We're trained in alignment to help watch you through the range of motion that you're working and make sure that you're doing it in a proper way so that you won't get injured. So it can feel a little scary, but it has a huge payoff. Stacey, thanks so much for coming on the show. Where can everybody find you and learn more about your work?
Well, thank you for asking. So my website is my clinic is New You Health and Wellness. So it's all spelled out, NEWYOU Health and Wellness spelled out.com. And also I wrote a book called The Pain-Free Formula, Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. And that's on Amazon. I have my Pain-Free Formula podcast. So that's on wherever you listen to podcasts. All of our socials are under New You Health and Wellness as well too. So hope to, answer any questions that your listeners have. If they have them.
Thanks so much. We'll put all those links in the show notes. Thanks again for coming on, sharing your wisdom with us.
This has been a blast. Thank you for having me.